Welcome back on the AM show. We get into our first conversation, which has to do with the exodus of our health professionals. Now, it has moved from worrying to critical. And this morning, we're going to dissect the different issues in the value chain and even go to the regions to interact with some of our reporters there, find out, pinpoint what is happening on the ground. But before I announce my guests, like you see behind me, we're going to perform some sort of analysis of the trajectory and how we've ended up here. So come with me. Now, looking at the Human Flight and Brain Drain Index, Ghana ranks 16th out of 53 countries in Africa for human flight and brain drain as of the 30th of, placing the 30th of 177 globally. And that is a pretty high rank, 16th in Africa, 30th globally. You look at the dynamics in 2015, a score of 7.6, 2016, 7.9, a high in 2017 of 8.2 out of a 10. Now, 8.2, or 8.1, I should say, in 2018. And then the numbers have dwindled in 2022. But the point to be made is that this number is still really high. On a scale of 10, that means that more than 2 out of every 3 to 4 out of 2 of them or more actually take flight. That is the situation we're facing there. If you look at it, just about 3 out of 4 in that score. But let's go to the next slide. It will explain further. When you look at the brain drain index, Ghana comparatively with other countries, okay? You look at Burkina Faso, 7.1, tied with us. Togo, 6.8, Nigeria, 6.6, and it's all on a scale of 10. Cote d'Ivoire, just over 6, so 6.1. Look at Ghana, 7.1. So this has become a crucial matter that we have to look at. And if you look at the main reasons for African youth migration, it begins to get you thinking about why some of our nurses are leaving. On Ghana Connect on 99.7 FM, last Friday, we heard about some of them. In fact, a nurse spoke who explained some of the situations. Someone who has just finished national service wants to leave. And she herself, who was speaking, admitted that she would want to leave. The question is why? Now look, in terms of the economic situation, a whopping 44% of them say they want to leave because the economy is simply not economizing, so to speak, for them. So 44%. Education, 41%. But we know that even when it comes to these statistics, some of those who often go for education, I have friends who are in the UK, US now, on the back of education, but they will also admit to me that they are also there because of the economic opportunities. So I get the feeling a lot of those here still will feed into this, if they were being very honest. New experiences, 25%. Those who say it is because of corruption-related issues, 18%. For political reasons, 12%, personal freedom, they don't want to be here, 9%, family reunion, 9%, and this is a very valid reason, security, 9%, also a very valid reason, and religion, 7%. Now, if you look at the nurses leaving the country in numbers per the World Health Organization and what we ought to be looking at as a country, Ghana is among 55 countries in the world facing a serious shortage of health workers. Mind you, we rank in the top 30 globally. We are 30th globally, so that is a huge concern. The UK red-listed Ghana for health workers recruitment in April 2023, but now there have been proposals about, for example, giving money to governments like ours for every person they take. But is that sustainable? That's the question. Now, in 2022, more than 1,200 Ghanaian nurses joined the UK's nursing register. So Ghana 4, that is the picture. Now, if you look at the numbers, this reminds you of something from our science books way back when, the eye and how it operates. But this is being realistic. Nurses per 1,000 Ghanaians. Now, the number of nurses, 4 out of the number of patients, 1,000. So already, there was a point when, per UN data, we had quite some leeway in terms of the numbers. But now, we have 4 nurses to 1,000 patients. If the nurses keep going, we all know what that dynamic would mean. Now, if you look at Dr. Antonin Siasare, presidential advisor on health, and what he's been saying, he says, doctors, for example, don't just go out there to go and work because of money. Every young doctor whom which I have been one of them, wants to be a specialist. Okay. So that is what he says, and that is the tale of the tape. Now, if you look at this final slide, professional nurses leaving the country, according to the Director General of the Ghana Health Service, Dr. Patrick Kumagwaji, he has also said, we're having a lot of professional nurses leaving the country for Europe and other parts of the world. They are taking mainly the professional nurses, and so there is the need to beef up professional nurses across the country. So there is the admission that this is happening. But the problem is not what we need. What we need to know is the solution. I'd like you to visualize, watch this scenario we're going to paint up next about brain drain, and right after that, I'll be introducing the guests for this conversation.
The 1993 year group of the University of Ghana, celebrating their 30th anniversary of completing school, has organized a seminar on the trajectory of the country socio-economically and politically. The seminar on the topic, 30 Years of Socio-Economic and Political Disequilibrium, Systemic Interventions to Salvage, highlighted the need to strategize methods for the development of the country. Dean of the Graduate School in the University of Ghana, Professor Robert Dakwose, in an interview, highlighted the need to train and equip more nurses to curb the current brain drain happening in the country.
We have serious unemployment problem today in this country, right? We have serious underemployment problem. We have serious graduate unemployment, so much so that today we have what we call the Graduate Unemployment Association or something to that effect. So if another country needs nurses and we have the capacity to train and to export, what's wrong with that? Remember, we are growing cocoa. Don't we drink cocoa? Don't we eat chocolate? But we grow cocoa and then we sell some. So why can't we build human capacity and export some? Of course, we also import capacities when we do need them, right? We have technocrats who have come to the country at various stages of our development to support us. It is not an issue of nurses are leaving us, so what are we doing wrong? No. Of course, if you take the healthcare system as it is, we do not have enough nurses. But what are we doing to train more nurses? And what are we doing to retain those nurses? Okay? In that case, you are turning what you call a brain drain into a brain gain.
Economist and researcher Peter Quarty, together with other panelists, advise the youth to consciously desire to gain work experience through internships and strategic workshops.
Sometimes when we look at your CVs, your job applications, they don't entice us. It doesn't tell us that you are ready for the job market. Where I schooled, you realize they come around, show you how to write your CV, they train you, they prepare you for the job market. I don't know whether our counseling and placement center does a lot of that. So we need to prepare our students ready, our young people ready for the job market. Don't do business as usual. So don't always start, you don't have work experience. Look for job placements, look for internships, etc. Start something. And wherever you work, if people start from 8, close at 5, start at 5:30, 6, start early. Don't do business as usual. Your employer will by all means notice you, and I'm sure you will get promotion.
I always say that your time, you do not have any reason not to do well. When 30 years ago when we were here, there were no mobile phones. We were using typewriter.
So that is the brain drain conversation, but today we're going hard on the health sector because now it's beginning to really bite. And like you saw the statistics, 4 nurses to 1,000 people. If the numbers keep dwindling as they are, that could be a national security risk because a health risk is a national security risk. Well, let's engage our guests this morning who joined the conversation. We have Dr. Arthur Kennedy, a physician and political activist and chair NPP Communications Committee 2008 campaign. We also have Dr. Tenkran Chum, General Secretary, Ghana Registered Nurses and Midwives Association. Then we have Umar Farouk, a UK-based Ghanaian nurse, and Dr. Franklin Esiedu Bekwe. He is Director of Public Health with the Ghana Health Service. Gentlemen, a very, very good morning to all of you, assuming all of you are in time zones where it's the morning.
Good morning.
Good morning.
So I'll start with you, Dr. Esiedu Bekwe, if you can hear me, sir. Hello, Dr. Bekwe.
Hello.
Good. It's really good to have you join the conversation. When you look at public health, I mean, we have the trajectory, how the brain drain has affected us at a high sometime in 2017, 2018, thereabouts. It's fallen a bit. But if you look at the fact that we have 4 nurses to 1,000 patients, and with the numbers dwindling, what do you make of the situation we're faced with currently?
Okay, thank you very much, and good morning to your viewers and other families. So, what I would say is the trend, if it should continue, will have a very precarious effect on health delivery. For now, I think that the deficit is more around the nurses, though we also have some doctors leaving. And what I gather from the data perspective is that it's mainly clinical nurses for now. And it appears that we also are the most serious. I mean, that is the world aspect of the current situation.
And we also know that a lot of those leaving are actually specialized nurses. In fact, it's either they are specialized or they are those with the most experience. Of course, you would think that those who are contracting them abroad would go for such people. And unfortunately, if we lose them, then we lose the very foundation of our health system.
Yeah, so that is the challenge. So I think that what the ministry is doing now is try to kind of coordinate the exodus of these nurses. So, in the past, I think that the nurses have been going on their own. But now the ministry has tried to have like a coordinating point whereby it gives an idea of the data in reality as they pass. They also have a way of trying to be sure that those living have actually served their bond and things like that. So those are factors that they are trying to do to check. To be very frank, it's difficult to halt brain drain if you look at the economic factors on both sides. So what countries need to do is how do you mitigate the effect of the drain which is occurring. I mean, this is not the first time that it occurs, but I think this one appears quite high gradient, which we need to look at. But I think that the opportunity for us is that we have a reasonable backlog of nurses and some doctors who can fill in for us in the intent. So I think that is the general situation. There's a lot of pressure all over the world to get more nurses to the Western world. And we are kind of disadvantaged of the community. But somehow we also have some nurses and doctors that we can rely on as part of the backlog.
Right. I know you're on a bit of a time leash this morning, so I just want to exhaust a few things with you before I come back for the second round. You've spoken about bonded nurses, right? Now, with these bonded nurses, I don't know, what is the situation with them? I pose this question because just this past Friday on Ghana Connect on 99.7 FM, I heard one of these nurses interact, and the point being made was, listen, people who are even doing their national service are attempting to leave. National service, and they already want to leave. And that nurse herself said she was ready to leave the country. So how is the bonding system working?
So if you are trained by the government, by the taxpayers' money, so you are kind of bonded for 5 years. So I'm looking at the regular migration. So like the one which is being coordinated by the ministry. So in that case, you need to be sure that the person going to another country is kind of clear. So that is the one. I'm not very sure what happens on the other side, whether you allow people who like better commerce not clear to work for them. But what we are trying to do, the ministry is trying to do, is make sure that they coordinate the exodus of these nurses. So they kind of screen them based on your application to be sure that you actually serve your term. It's not foolproof, but I think that's one way that could be done to make sure that we kind of regularize the departure of these nurses for the country. And I think that was said by the one Professor Koto or something like that. We have the reasonable number that if it can be regulated properly, they can have an arrangement for some to go and come back. We've had this arrangement with Barbados, and I think that it's working well. So that's how come the ministry is coming in to kind of regularize this migration of nurses to the Western world.
Do hold for me. Let me bring in Dr. Tenkran Chum, General Secretary, Ghana Registered Nurses and Midwives Association. You rather, I beg your pardon, you rather are on a time leash. So I'll devote some time to you on this matter. When you look at the current landscape, and you can see right there in your shot, the main reasons for African youth migration, topmost, economic reasons. Then there's education, among others. For you, from where you sit, what is the foremost reason that our nurses and midwives are leaving the country?
All right. Good morning to your viewers and my senior colleagues on the call. Yes, to answer your question specifically, it's not different from the data you have. And as we often say, we need to premise this conversation on science and data. Yes, most of the push factors are economic reasons. And when you listen to the employer, what I'm not too happy about is that,
and by the employer, you're referring to the Ghana Health Service, and you're referencing...
Because they are the largest agency for the ministry. Okay. The Ministry of Health is a policy formulator. We have various agencies under it. So Ghana Health Service is the largest agency of the ministry. I reckon that there is no way we can pay competitive salaries as being paid out there. Nobody doubts that, looking at the economic of scale and our current GDPs and the rest of it. But we need to think outside the box. Dr. Asiedu Bekwin made mention of the fact that this is not the first time that nurses are leaving the country in droves. Now, what did we put in place to checkmate a previous exodus? That is what we should be looking at. And let me just maybe refresh the memory of Dr. Asiedu Bekwin. Now, no nurse is bonded, all right? I mean, when the allowance structure was removed by the previous...
Just to confirm, sir, you're saying no nurse is bonded as of now. There's no bonding for nurses.
As I speak with you, by 2015, 2016, when the previous administration cancelled the allowances, the bonding ceased. So no nurse is bonded, unless those who came or who took the bond prior to that. But by now, they've all finished serving their bond. But that is not more important to me. What is important to me is to find a practical solution to the current exodus. And I'm saying that it can be controlled. Now, your data has shown clearly that one of the major push factors is economic. Yes, our salaries are nothing to write home about. And I have preferred these solutions to government all the time. Now look, the nurses and midwives in Ghana will want to stay in this country to serve the good people of Ghana. But what is paid to them is nothing to write home about. What can we do practically? Number one, I'm saying that in 2013, the market premium of nurses and midwives were frozen. Previously, when we were placed on the single spine, we had a component called market premium. So anytime that the salary goes up or went up, the market premium also inched up, and that will help to checkmate inflation and all that. Now, because it was frozen, the gains that we made had whittled. It has been revised for certain professional groups. I don't like comparison. What I think the government should do is to be able to raise the market premium. Just by pegging the market premium to the current basic salary will be enough, okay, to stem the attrition or the exodus, if you like.
You say one of the best solutions would be to increase the market premium, but knowing our economic situation right now, is that a practical thing to hope for?
No, I'm not even saying to increase the market premium. I'm saying that they should just tie it to the basic salary of the current salaries of nurses and midwives. Okay, they should just revise it from the 2012 basic salary, because the market premium is tied to the 2012 basic salary. And how much was the 2012 basic salary? So if they inch it up, tie it to the current basic salary or 2020 basic salary, it will certainly give a certain respite to the nurses and midwives, and they'll be prepared to stay. Again, we had what we call car waiver, and I'm sure doctor has been around for a very long time, and he appreciates some of these things. If you were a nurse or a midwife, a doctor, and you work for a while, you could apply for that car waiver, okay, to clear any car, below an engine capacity of 2.0. That was removed by the previous administration. So anything that went for nurses and midwives in Ghana were eventually removed. So these were the things that are causing this. And let me tell you something. There is lack of recognition and respect for nurses and midwives in Ghana. Look, when we were negotiating for the single spine pay policy, we had not churned out specialist nurses and midwives yet, but we negotiated for analogous grades because the program was about to start. When the program got started, we negotiated for levels of placement of these specialist nurses and midwives. Ask me what has happened to that. Check the Director General's letter that was written in 2020. Attached was the salary levels that were supposed to be paid to these specialists. As I speak with you, they have, I don't know how they went about it without records to the unions who negotiated for these salary levels. They have downgraded the specialist nurses. The nurse specialist, midwife specialist was to start from 22H on the single spine. The senior specialist nurse midwife was placed at 23L on the basic salary, on the single spine salary structure. The consultant nurse midwife specialist was 24L. As I speak with you, they brought them down without records to the unions. So these are some of the issues that are causing the problems we have on our hands. So there are practical solutions that can be put across. We have petitioned the Fair Wages and Salaries Commission. We expect that as a matter of urgency, they revise, because we are not going to tolerate them. Okay, these are negotiated levels, and a letter was duly written by the Director General of Ghana Health Service with the attached levels. And I see no reason why any human being born of a...
Hello, Dr. Chum. Well, hopefully with time, we can get Dr. Chum back on the connection. Dr. Chum, I don't know whether I saw that your connection had frozen. It had taken a bit of a hit. We'll try to get you back when you're back on. But let's also, and interesting issues he's been talking about, the market premium that was taken off, among others. Dr. Chum, if you can hear me now, I just want to find out from you, what sort of negotiations have you had with the current government? You keep saying the former government took away your market premium, the car waiver, and the rest. What has the negotiation been like with the current administration? What has the reaction been?
All right. If you check the current administration's manifesto, they stated therein that portions of it, which I have read, that they will restore the car waiver. It has not been restored. In fact, we met the vice president and we placed this before him.
When did you meet the vice president?
Oh, that was last year. No, 2021. I mean, thereabouts. I remember.
So it's been 2 years.
It's been 2 years. Nothing has been done about it. And as I've said, in respect to the placement of the specialist nurses and midwives, we have written to the Fair Wages and Salaries Commission last year, and we haven't heard anything. I prompted my president. She was away, she's back. I believe that this week.
It looks like the connectivity is going to give us problems this morning. Crucial point he is making there, but he makes the point that they had approached the Vice President, Dr. Mahamudu Bawumia, with these issues about what this administration could do in terms of their market premiums, car waivers specifically. That's what he made mention of. It's been 2 years because this has been since 2021. Promises were made to them. And how interesting is it? In 2021, promises were made, were not kept. Then we saw the COVID scourge and its impact. 2022, of course, by 2021, we had already been going through it. 2021 promise made, not kept. 2021, we started seeing quite a spike in, nurses going out of the country. 2022, even worse. 2023, it's become a headache. So you can see, promise made, not fulfilled, and here we are this morning having this conversation. But let me bring in, while we wait to reconnect with Dr. Chum, let me bring in Dr. Arthur Kennedy for your initial take on what is happening. You yourself are a physician. What do you see? Hello, Dr. Kennedy. Can you hear me?
Hello.
Who's on the line now?
I can hear you. I can hear you now. Yeah, I can hear you now.
Is that Dr. Chum?
Yes, please. I'm on the line. I can hear you now.
Okay, so you were telling us about the 2-year-old promise. Please go ahead.
Yeah, so I made mention of the fact that we met the vice president of the land and we placed before him that we really need the market, the car waiver to be restored. All right. He made mention of the fact that, there could be policy dissonance because they have started assembling cars in Ghana. And we made it clear to him that the salary levels of nurses and midwives will not be enough to be able to purchase brand new cars, unless, of course, they have an arrangement where government was going to distribute the cars to nurses and midwives and later maybe spread the payment period for them for maybe 5 years or 7 years. That alone, we suggested that could even serve as a bond. All right. So basically, that wasn't fulfilled. And as I said, there are major issues that we raised, even in our recent negotiations. 2020, we went for negotiations. All right. We negotiated with Fair Wages and Salaries Commissions. There are other things that were supposed to be implemented, something like rural incentives. Okay, we negotiated for a rural incentive to be paid to nurses and midwives. As I speak with you, it has never been paid. Book and research allowance for those who are training these nurses and midwives that we keep talking about, that we have them in abundance, have not been paid as I speak with you. So there are major issues that borders on nursing and midwifery practice in Ghana, and as far as the remuneration is concerned. So these are some of the challenges that we have. And if we don't do anything about it, my brother, the situation will be worse. And if somebody tells you that we have a 4 to 1,000 or whatever patient ratio, I even dispute that figure.
You think it's lower?
If we talk about nurses, there are various cadres of nurses. And by standards, by international standards, the professional nurses must be more than the auxiliary nurses. What we have in Ghana is the other way around. Yet we are able to boastfully talk about the fact that we have nurses in abundance. We don't have them in abundance. As I speak with you, there are several nurses at home who have not been employed. But it doesn't mean that we don't even need them or there isn't shortage. Just last week, the GMA president was talking about the fact that his hospital that he superintends, about 30 nurses have left the hospital this year. So that should tell you that the effect is coming on and people must watch it. All right. Otherwise, we have a problem on our hands. We need to quickly look at conditions of service of nurses and midwives and listen to the leaders and begin to put in policies and programs that will retain the people. Okay. That's more important.
All right. Just hold for me, Dr. Chum. Hold for me. Let me bring in Dr. Arthur Kennedy. Dr. Kennedy, can you hear me now?
Yes, I can hear you.
Great.
Good morning.
Good morning. You just heard the lamentation of Dr. Chum of the Ghana Nurses and Midwives, the registered group, Midwives Association. And he says that there are some things we could have done to cushion the Ghanaian nurse, but we're simply not doing them. We're not working on their market premium as far as the single spine salary structure is concerned. We're not giving them car waivers. There is no incentivization, so it is very easy for them to leave. He even adds another problem. The bonding situation, which was extant when the previous administration was in power, was cancelled because of some decisions that were made. And so now the nurses we have are not bonded. What's your reaction?
My reaction is one of sympathy, but not surprise. I think these issues actually go across all healthcare fields, and actually most of my remarks I was going to say would apply to nurses as well, that doctors and nurses work together as well as other ancillary healthcare staff. But let me preface my general remarks by saying that health migration is a global phenomenon that even though it affects Africa more severely, it is even beginning to affect advanced countries. When you look at OECD countries, for example, between the decade of 2006 to 2016, the percentage of Israeli physicians working abroad rose from 10 to 14%. India has had chronic migration problems. Germany is now losing healthcare physicians to the Netherlands. Eastern European countries are losing them in droves to Western European countries. Canada and Mexico, probably the only country that doesn't lose physicians is America. And even here, there is rural-urban migration of physicians and nurses as well. So I think that when you look at the factors, Dr. Tinkran has elucidated them. Most of them are economic, but it is not absolute economic. I think part of it is also relative. In other words, people look at how they are doing relative to other professionals. You know, for example, I practice in the United States here. There are only 100 United States senators, but I get paid better than a United States senator, which means that the society places a certain premium on my professional skills. I think that we need to look at not just the absolute salary. For example, a house officer in Ghana gets paid about average of 500, then it rises slightly as they become general medical officers and then specialist physicians. I'm just saying that, one, it is their own economic environment that they are looking at. And the statistics that you put up there are very familiar. It's economic, then there is professional advancement or education, and there is general work satisfaction. Then there is the work equipment. For example, as I speak to you now, maybe in the last few days it's been fixed, but dialysis, I'm told, has not been available at Kolebu for months, at least as at last week. If you go to places like RID, CT scanners and MRIs have not been functioning. In other words, there is a dearth of appropriate equipment. So when people who are highly trained, for example, I work here and I know that dialysis is very routine and I'm working in Ghana and my patients can't get that, it leads to less job satisfaction. And of course, the other point is that even once people have left, we make it more difficult for them to come back. We have these problems that Dr. Tinkran eloquently talks about, but when there are nurses abroad who want to come back, it is made very difficult for them to come back. And not only that, yes, we talk about the brain drain, but
you say when nurses, some of our nurses leave, it is made difficult for them to come back. What do you mean? And also add the perspective, Doc. You know that you say it happens everywhere, which is true. But the fact that we're placing 16th out of 53 countries in Africa and 30th globally is much more of a problem, isn't it?
Oh, it is. But and actually, I am even surprised we only place 16th. I think if you look at North America, for example, physicians from sub-Saharan Africa, we come third, Ghana, behind Nigeria and South Africa. We punch way above our weight population-wise. You look at Canada, it's the same thing. So I actually think that these statistics actually understate the significance of the problem. So I think it is a very significant problem. But I'm just saying that the reality is that we need doctors and nurses. So when those who are outside want to come in, we talk about exams, we talk about onerous procedures, about how they can come back. And then I'm even saying that while they are out there in situ, there are a lot of things that we can do to use their skills. Every year, thousands of Ghanaian physicians in the US and Britain come for holidays. There are ways that you can harness their skills. There is telemedicine, so that some of my classmates, like Professor Japon and Kumase, Dr. Flu, who are very renowned physicians here, can actually join rounds there and actually see patients. There are situations where a lot of Ghanaian physicians on faculties here can actually be here and be teaching. And the same thing goes for nurses. I'm just saying that we need to make the best of the situation. And in addition to what Dr. Tim Crane said about car allowance and others, actually I'm looking at more significant things. Actually, Ghanaian physicians talk about the Mustafa Hiaji syndrome. What they mean when they say that there's doctors who gave decades of dedicated lives to Ghana, and then when they were in retirement, they were living in penury. So we need to look at retirement security.
Interesting.
In helping people get accommodation. Pardon me? Pardon me?
Your connection froze for a minute, so I thought you had ended. But please land on the point you're making.
Yeah, I am saying that we need to look at retirement security for those who are back in the system. And that young doctors used to talk during my time there about the Mustafa Hiaji syndrome. And when they said that, what they meant was they were referring to doctors who were distinguished and very respected, who had given decades, 3 to 4 decades of service. And then when they retired, they lived in penury. So we need to look at retirement security. For example, after somebody has worked for maybe 10 to 15 years, give them half of their retirement money, and then the government match it as down payment for a residence, and then the rest of their career, they are paying for it, do the same thing with vehicles. When you do those things, then they feel more invested in the system.
Right.
And then also make sure that their living circumstances matches that of their colleagues who went into politics and other professions.
Thank you for that initial submission. There's this message coming through from Caleb of being a J-Mensa who says, nurses not posted are more than those migrating. Make that also a topic for discussion, JoyNews. You may have missed the media discussion. Sometimes you send in messages like this. We've had a number of conversations on that, first of all. Even in this conversation, it has come up. And I see the relevance of it, but don't make it as though we didn't have it on the chopping board. Well, let me come to Umar Farouk, who is a UK-based Ghanaian nurse. Umar, good morning to you.
Good morning, Benjamin. Thank you for having me, and good morning to all your viewers.
Right. How long have you been in the UK? How long did you leave Ghana to pursue nursing in the UK?
Well, I've been in the UK since August last year. So I've been here for about 10 months now.
Okay. And in Ghana, for how long did you practice?
Well, professionally, I practiced for 6 months, but not as a government of Ghana employee. I did so as a private sector nurse for about 6 months. Okay.
So let me find out from you. Of course, you were not bonded because you went through a different system. But why did you leave Ghana for the UK? What was, if I asked you for your top 3 reasons, what would you say?
So thank you very much, Benjamin. To start with, looking at what the spokesperson for the Ghana Health Service said, and
he's the director of public health.
Yeah, the director of public health for the Ghana Health Service, and also the general secretary for the GRNME said it clearly points out the fact that excuse me to say, as Ghanaian people, we don't even understand, what the numbers means. What exactly the numbers are. We have the GRNMA secretary talking about, the economic aspects of it. The fact is that it all boils down to the economic aspect, but there is no job security. Trust me. I graduated, 3 years ago, and I had my professional license some 3 years ago, and trust me, I didn't have any hope. I didn't know when the government was going to employ me as a trained nurse. I didn't know when I was going to mechanize into the government system. I didn't know. In fact, I didn't know where my daily bread was going to come from. I was working with a private hospital. I told you I endured, a private system in Ghana for 6 months. And trust me, this 6 months, I was paid a paltry 500 cedis a month as a degree nurse. I'd gone to the university to do 4 years as a nurse, and I was paid 500 cedis. These 500 cedis, I paid my bills, I had to pay my rent, and in fact, I had myself and then some other siblings to feed as well. So you can imagine. Just when I knew I had the opportunity to, to come to a system where I'll be appreciated more as a nurse, I took it, and then I came. But the truth is that, just to remind the Director of Public Health and then the GRNMA that the issue of, nurses in Ghana is way broader than we see it. We have more nurses home unemployed than we have, currently employed in the system. I have been the vice president for the National Health Student Association of Ghana. I was one time a vice president, and I have a very good idea of what the numbers look like. Look, we have more than 30 private universities training nurses in Ghana. We have the government, the public nurses training, we have the private nurses training, and then we have the public universities. Almost every single public university is training nurses in the country. So at the end of the year, we have thousands of nurses churned out, annually. And our system.
So are you suggesting, Umar, that the number of nurses trained are far more than those who are leaving the country? And so if we got our act right in terms of the numbers here who are unemployed, would be able to solve this problem?
I tell you solemnly, we will be able to. Look, as I was saying, we have thousands of nurses being churned out. For instance, the University of Health and Allied Sciences, where I graduated from, my year alone produced more than 300 of us. Nurses, midwife, public health nurses. And as I speak to you, every single one of this group, except for those of us who have left the country, every single one of this group is at home with, no hope of being employed anytime soon.
You're saying that of your year group, the 300 or so, apart from those of you who have left the country, all the others are at home?
Every one of them is at home, except for those who have decided to take private jobs.
Wow. So tell me, you were earning 500 cedis from a private facility. If what we know from the government end is anything to go by, you could have been earning about 1,000 something, 2,000 if you were in the government setup. Anyone here could correct me if I'm wrong. That is the information I have. What are you earning now in the UK, comparatively?
Well, in the UK, I'm on what we call the Agenda for Change pay structure, because I work with the UK NHS, which I'm going to, talk briefly about it and then compare the two systems. I work with the NHS, so my salary is a public knowledge. I know, as a band 5 nurse, band 5 is the starting point for registered nurses in the UK. As a band 5 nurse, starting from the bottom of band 5, I earn about 15 pounds every hour, and I'm contracted for 37.5 hours a week. So if you round these figures, this is an average what I earn. That is minus my extra shift, minus the
so you're basically telling me 15 by 37, which is which are the hours you do in a week. That would give
Yeah.
£555. That multiplied by 4 is £2,220. And this doesn't even include the other extra hours. So let's round it up at about £3,000. You're telling me you're earning about £3,000 a month compared to 500 cedis a month in Ghana.
Yes, weeks when I work very hard. I earn even more. Because in the UK, Sundays, Saturdays, and then nights pay more. You get about 60% of your hourly wage added to every hour you do in the night and every hour you do on Saturday. You have about 30% added to every hour you do on Saturday, and then about 60% added every hour you do on Sunday. So if I decide to be hardworking and then I don't lazy about, I could even work more than that compared to where and the work is so flexible. I sometimes work just twice a week, sometimes just 3 times a week. I just work in a way that I meet my 37.5 hours every week, and the rest
Umar, this is the interesting bit. I've just been doing some calculations. Now you say that, correct me if I'm wrong. You say even the £3,000 in a week that you work hard, you get over that in terms of your add-on time. So let's peg it at £3,500. Is that a healthy figure?
Yes, it is.
Okay.
I'm able to pay my bills. I'm able to pay. After tax, I am able to get like 2,500 in my hands. I'm able to pay my bills. I'm able to pay. To take good care of myself. I just got married recently. I'm able to feed my wife. I'm able to, to feed my family down there. Look, I'm happy.
So you married from Ghana before you left? Is that what you're saying?
I came back to marry. Recently.
Okay. Now, Ghana, if you want to understand the situation, this is what Umar is saying. And I broke it down for you. We've done the calculation. £3,500 averagely. Okay? That would give you, and that is what he would earn in a month if we do the breakdown. I've already done the calculation. If you multiply that by a conservative figure for the pound of, let's say, about 14 cedis, yeah? 14 cedis. Yeah. 49,000 cedis. 49,000 Ghana cedis. Or let's say 50,000 Ghana cedis. Compared to 500 cedis at a private entity, or maybe 2,000 cedis at a public facility. And he's on band 5, the lowest. He's at the lowest in the NHS. He's earning 50,000 cedis a month. I'm not trying to encourage more people to take flight. No. I'm saying that as a media person, I have to put the figures out there for ordinary Ghanaians to know and for the health authorities to work at it. You may not necessarily be able to compare and say, we're also going to pay them 50,000 cedis a month. But how do you meet them halfway to make their lives less miserable here? Umar, this is quite a situation. So with this, would you ever contemplate coming back to Ghana to practice nursing?
Ben, it is quite a dicey situation. I can't give an absolute yes or no answer, but as patriotic as I want to be, as a citizen of Ghana, if there is a call for me to come back and serve, I've been in the UK for about 9 months, and then I've got to practice stroke nursing. Firsthand. I didn't have to go to school to specialize in stroke medicine. If I want to specialize in stroke medicine here, I can. But for the last 10 months, I've been working as a nurse here. I've seen, what it means to take care of people with stroke. Right now, if you ask me how to thrombolyze someone, which of course I don't think it is done in Ghana firsthand. It may be done some way, but the efficient way it is being done here is not what is happening in Ghana. So if you ask me to come and then give what I have to the people of Ghana, I may come, but not necessarily because of the money, but because I probably have something to give to Ghana. If we have thousands of stroke cases happening in Ghana, and if I come and then I can help, stop half of those or even 30% of those as a nurse, I'm happy to do that. But later in the future, when I've secured my family, and then when I know I'm well stable, and then I will have nothing to lose when I come back to serve. I probably will do.
Hold for me, Umar Farouk. You've got me, like the Americans will say, you've got me shook. You've got me shaken with some of the dynamics. But let me bring in, before I bring in Dr. Franklin Esiedu-Bwekwe, Director of Public Health at the Ghana Health Service. This message says, Sakwa Yunus Unique says, the job security is more of a problem than the salary is. Like Farouk, I also had a hard time getting a job, even in the private sector. And when I had one, it was on a 600 Ghana cedi salary. Dr. Bekwe, this is what we're faced with realistically. Maybe we cannot pay our nurses 50,000 Ghana cedis a month. But what practically can we do to incentivize their work, to get them to stay in Ghana?
Thank you very much. So let me say that I work for Ghana Health. I'm the Director of Public Health. Some of the issues, I think that, as has been said by the nurses boss.
Doc, I'd appreciate it if you could speak up a bit more. Just a little more for me, please.
Yes, what I'm saying is that I think that the head of the nursing group has tried to come clear what are the issues and how it can be addressed. So those discussions, I think, go beyond me as a Director of Public Health. It was about finances. It's about resources to achieve what needs to be achieved. So that's why I talked about meeting the Vice President, and then also meaning that it needs to see how the budget issues coming.
Yeah, but they met the Vice President 2 years ago. Nothing has been done.
Yes, that's what I'm saying. Is that so? I'm sure he can better explain what are the clear next steps. For Ghana Health Service as an agency, we wholly rely on the ministry because it has to do with the budget. We go to the Ministry of Finance. So I think that it makes a lot of sense that Ghanaians should appreciate that people should get more. It's about the whole national case. So which part are you cutting? And I think that because when you go to this side, this other side comes in. So I think those are the issues that you need to look at. Are we prepared to say that nurses and doctors should be paid more compared to others? I mean, those are issues because it's about the same cake. So where are you cutting to get more? But I think that what you can look at is this issue about waiver. I think that is something that was very useful because it helps a lot of young guys to be around because it's nice if you are driving around. So those things I think can be done. And you're talking about the issue about the premium. I mean, if it could be maintained as it used to be, those are little things that can suffice. But to say that, let's say, the doctors and nurses to get that high amount of money, then I think that the average Ghanaian must be able to appreciate the fact that there's some relativity in terms of professors. And then that one will make way for the things to be better. I will say that the other factors that influence somebody moving out of the country. Somehow, in terms of education, I mean, when Ghana, we introduced Ghana College, it helped some Ghanaians to stay. I mean, my class, almost all my friends stayed. So there could be other factors for how people stay. But then what you need to do is that you need to encourage them to stay. One other issue I need to say is that the issue of the backlog needs to be cleared. Because, as you said, I think there are about 2 cohorts that are still at home. So it all comes to do with the financing of the current situation, so that these issues can be cleared. The Human Resource Division or Department, what they're trying to do is that they're trying to encourage those who are, let's say, not fully professional nurses to also do a top-up so that they can also become professional. And then this issue of a backlog needs to be cleared. The other issue is those who have finished and they are at home. The issue is before they get a financial clearance, can they be used as like interim nurses to get some allowance before they get fully employed? One thing I also need to state is that the government pays about 5 or even 4 times what the private pays. And I think that one thing
but that is exactly what I said. I mean, they were talking about 500, 600, and I said that averagely you would have about 2,000 around that figure. You can correct me if I'm wrong, which is what nurses would be paid. Depending on their different grades, it would change, right?
Yes. So which is good. But one thing I want to say before I go off it, Ghanaians must be prepared to say that some category of persons should be paid more. If that is accepted, then I think that negotiations can move in that direction.
So which categories of persons should be paid more? And just add this before you leave. Umar proffered, he says, probably the best solution is, look, the numbers who are graduating from nursing school, his batch, 300. Apart from those who got, the few who got jobs with private entities and those who have traveled abroad, the rest of them are sitting at home. We can plug the situation with the exodus. We can get those who are unemployed on board. Why aren't we doing that?
Yes, as I told you, you have to do the financial clearance, and that one goes beyond the director of publishing. I think that we need to speak to the issue about finance and debt, Parliamentary Select Committee on Health and Finance. It's about how much of our cake are we prepared to invest in health. And that is one issue that which I cannot really answer. And that's why I'm saying that are we prepared to make sure that some portions of Ghanaians get more than others without agitation? That's an issue that I can answer. Ghanaians must be able to answer that question.
Dr. Siedu Bekwe, we know you have to go. We're so grateful that you took the time to join us. Thank you for your time, sir.
Thank you, sir.
Dr. Franklin Siedu Bekwe is Director of Public Health at the Ghana Health Service. I want to take a few of your messages. Some of you are saying some very interesting things. Before I come to Dr. Tenkran Chum one more time. Now, Kwame Sapong makes a certain argument, and I want to deal with what he says. He says, a media personality in a high-profile media house like Joy FM or JoyNews in Ghana would earn about 100,000 Ghana cedis a year. I guess you should also encourage media personalities to also leave Ghana. And he says, you too can leave, and you are not in chains. Well, a few points of correction. The figure you mentioned, roundabouts that some media houses would be able to pay that. But I'm telling you for a fact, the media people are not paid well in Ghana. That's a conversation we can have some other day. And I'm not saying it is en masse, but if you look at it, 90+%, very few are actually paid something that is decent. The other bit, we are not encouraging people to leave. When you watch it or follow a conversation, follow it with some sort of above the board thinking. We are not, by this program, encouraging people to leave. We are highlighting the issues to find solutions. So think through the matters. Don't come here and post things as though someone were here trying to encourage people to leave. That's not the conversation. This one says, I completed or graduated in 2020, did my NSS in 2021, and I've been in the house since. The private sector pays 500 to 600 Ghana cedis. It goes on and on, but I can't read the rest. Ibrahim Umar Farouk says, you see what Dr. Franklin is saying is one of the big things in Ghana. Other cadres think nurses cannot take more salary than they are. So he's saying that is one of the chief problems. I'll end with this and go to Dr. Chum. I just joined the NHS. Ibn Sraj says, I just joined the NHS 2 months now and I've saved so much already. I spend less than £70 a month on food and that is so cool. But when I was back in Ghana, I spent a lot on food. It goes on and on, but I see your message coming through. I'll read that later. Dr. Chum, so looking at the disparities, looking at the economic boons elsewhere and what we're faced with in Ghana, we also cannot say that we're all going to leave Ghana. Who will develop our country? What is the way forward?
So thank you once again. The way forward is very simple. Now, when people complete a period of training and they stay in their house for a very long time, when even you engage them, they have to be upskilled or reskilled. And whilst they are waiting, their minds go all over the places. And that is how, for instance, Farouk left the country. So if you're able to absorb the people as quickly as possible, it will stem the attrition. Number one, I'm saying that we need to raise the market premium. Let's peg it at the current basic salary. And that will give us an ample opportunity to regularize the system. Now, if you don't do anything about their allowances, my brother, they will leave. They will go. I mean, Farouk is even receiving the least amount, right? I know.
Oh, we lost you right when you were going to make a crucial point, Dr. Tenkrang. So let's see whether we can get Dr. Chum back on the line. While we wait for him, there's this message from Degura Bettinos who says, Benjamin, even those in the field currently, our welfare has not been taken proper care of because some of us are still battling with COVID or battling COVID-19 complications with our own little resources. So you're basically saying you contracted some of these, maybe you have long COVID or something, and you're battling them on your own. It is only God that is protecting us. But if the trend continues, we will even leave to Burkina Faso and forget about Ghana. Wow. But Burkina Faso also stands at 7.1 in terms of the brain drain. So that would be interesting. Dr. Tenkrang, you were making an important point about Umar's rate and how much he's paid. Please go back and continue. Hello, Dr. Tenkrang Chum. Maybe we'll try to see whether we can get you on phone so you can make your point, because it's very important what you were saying. Let me bring in Dr. Arthur Kennedy. Doc, you've heard it all. You've already said that, look, you are even paid better than a United States senator. They place a premium on you. Why aren't we able to do that in Ghana? And look at the consequences. What are your thoughts?
Well, priorities. First, like the others have said, when people graduate, we should post them quicker. In the US, everybody knows that on 1st July, new doctors start as interns. Thousands of people, and yet every year they start on time. I think that this financial clearance delays is incompetence. We can plan ahead. We know how many people are going to graduate. We know we need them. So I don't understand why it should take more than a year sometimes to place people. And the other factors that they've said are important. The fact of the matter is that when they talk about the cake, health industry, we pledged in Abuja in 2001 with other African countries that we're going to spend 15% of our budgets on healthcare. The highest Ghana has gotten to was 4.5% some years ago. And last year we were at 4%. So we need to spend more on healthcare and more on the retention. And when you look at the other priorities on which government spends money, yes, the cake is very difficult to slice and dice, but I think that there's a lot of wastage in the cake. And spending on healthcare is not selfish or focused just on healthcare personnel. It is for the general health of the population. So one, we need to increase the size of the cake. We need to direct more to healthcare, and we need to place people quicker. We need to cut down wastage. We need to give people opportunities of professional fulfillment by getting equipment where they work, by helping them to upgrade their skills, by getting supportive and considerate bosses, because sometimes people just leave because their work environment is not conducive to their professional development or happiness. And then, as Rwanda have shown, when you govern a country well, more health professionals stay. Less Rwandans are going into exile, even though they are not paid that well. More of them are coming back because of a meritocracy in promotions and people getting scholarships to go abroad.
Let me bring back Dr. Chum. Doc, hopefully we can continue with the conversation this time. You were making a point about what Umar gets being even the least and what you know.
Exactly. So what I'm saying is that what my brother Farouk even mentioned is somebody on the list of the band, all right? So it tells you that quite senior people over there are collecting high sums of money. But that is not the issue in contention. There is no way we can pay salaries as is being paid out there. I reckon that. So what we need to do is to be very intentional about what we need to give to our members. So I've just suggested that, look, let's raise the market premium. After all, people are leaving, so we need retention premiums. All right? If anything at all, we should even give retention premiums to those who have stayed or who are sacrificing to stay. Now, just to add, because I quickly have to move into a VSF for something else. I think that we need to also employ the new people that qualify, because when they stay in the house for a very long time, their mind begin to wander about, and that is how Farouk even ended up in United Kingdom. If we absorb them as quickly as possible, they retain whatever competencies that they acquired in school. If they stay in the house for a very long time, we need to upskill them or reskill them. Okay, and that comes with cost to the government and of course to the employer. So I think that as a matter of agency, we need to look at the service conditions of nurses and midwives in Ghana. It's terrible. Even if you are a nurse and you are sick and you go to hospital, you have to pay from your own pocket. Despite the fact that you are paying so much money towards the national health insurance already. Maybe at another time we can have a conversation how much nurses and midwives pay towards the national health insurance, yet when they are sick, they need to pay out of pocket.
Thank you for those submissions that you've made. Right before we wrap the conversation, gentlemen, let's go to the regions. In recent times, we've spoken about the Ashanti region and 300 leaving just within a short space of time this year. Ohiming Tewia, my colleague, joins the conversation. Ohiming Tewia, do walk us through what you've been gathering so far in terms of this brain drain and nurses.
Thank you, Benjamin. The situation in the Ashanti region.
I have an appointment at 8:45.
It's a bit dire because, according to the regional health director, Dr. Emmanuel Kojo-Timprine, 304 nurses applied for a leave of absence, and all the 304 nurses in the first quarter of this year had left the shores of the country in search of greener pastures. And he says, though they are not done with auditing, the number of people applying for leave of absence is happening on weekly basis. So on every week, the directorate received not less than 10 applications. My checks from both the regional hospital at Atonsu Agogo, which is commonly referred to as Kumasi South Hospital, indicate that many of the health professionals, especially nurses, have left, and is giving the managers a hectic time in arranging for who to work at the facility. So this has affected the work schedule, what they call the duty rosters of the facility. For instance, at the male surgical ward, out of 20 nurses that are posted there, the last check being last week, 20 of them were on duty, and the next day, 12 has left, and it's left with only 8 at post. So the hospital has been forced to sort of give more additional work to the staff available at post. The management described it as a rapture-like, exodus of health professionals, because you meet somebody today, you are not too sure who will leave tomorrow. Tomorrow you have a meeting with the person, you go sit in a meeting, and the information you pick is that the person has left the country and the person is not available. From the Komfo-Anokye Teaching Hospital, the story is not different. And from other health facilities that I have checked, there are instances where lab technicians have left, radiographers have also left, leaving the equipment behind, leaving the managers a hectic time in finding replacement for some of these areas that require special skills before they are able to operate. So out of the 304, I did my own checks. I spoke to, let's say, 10 nurses. Out of the 10 nurses I spoke to, 8 of them have started the process or about to begin the process to travel abroad. So in the Ashanti region, they say it's not only about working conditions, it's also about the money and the economy of the country, where you have money but you can't get anything out of the money. So they also want to also go travel abroad so that they can also have better working schedules and also better working conditions, where they have opportunities to also upgrade themselves. And so, Ben, I would say it's all over the region, but those who are hard hit are the teaching hospital, Komfo-Anokye, the regional hospital, and then some district hospitals as well.
Well, Ohiming, thank you for that update. I don't know, though, whether the authorities you've spoken to have any means, any plan. How are they going to resolve this very quickly? Did they share a plan with you?
I spoke to the Deputy Director General of Ghana Health Service, Dr. Anthony Adolfo, who says for now it's very difficult. If the people are leaving because of pounds and dollars, it's very, very difficult because Ghana's currency, our city cannot even match the dollar and then the pounds. But as a health institution, what they are trying to do is to give a thought to it and try to sort of open up, employ more people, and also give opportunities, training opportunities to those who are here, so they can also benefit from the service. But in general, he says it's very, very difficult to retain some of these professionals who are leaving. And there are those with a lot of skills, those in mental health, those are the theaters, emergency service providers, they are the ones leaving.
Ohiming Tewia, thank you so much. Ohiming Tewia is with the health desk here at JoyNews. Of course, he's also with Love 99.5 FM. That is the tale of the tape. Before you deliver your wrap-up comments, about 40 seconds each, please permit me to walk through these messages. Now, this one was sent to me by, let me just leave it there. The person says, Ben, good morning. The nurses who just finished their rotation in June never received their national allowance for the whole duration of 12 months. 12 months, no national allowance. They were same as other tertiary students who served the nation in their obligation as national service personnel. Now, new ones just started this month. Because of our benevolence, we were overburdened by the needs of these professionals by providing their rent and monthly chop. We are all stressed financially. And I don't know whether you want me to mention your name. I just saw, do you want me to mention your name, sir? Let me know. But then this one says, meanwhile, the live stream, Ghanaian nurses are working harder and spending more time at work than even in the West, yet they are paid less. I'll be reading short portions of your message. This one, Louis Azure says, with the issue of returning to Ghana in the future, it is not bad, but the system currently does not allow that, and the leaders of our institutions will go to every length to frustrate you. So even those who want to return, there are mechanisms in place to frustrate you, so to speak. Caleb Ajay Mensah says, Akakbo, kindly note that the authorities should do their statistics well. How many nurses retire? How many have completed and are yet to start rotation? How many have finished rotation and are yet to be posted? All these people should be factored properly in to help feed the health sector with personnel to work. Rana Desi says, we have more than 1,000 nurses unemployed. What is preventing government from engaging them in the service? Well, you know about the financial clearance and all of that. All right. Kwame Sapong comes back with, Kwame Sapong, I really don't get your thinking, and I don't know whether you're thinking as a Ghanaian or just throwing things in there for whatever reason. But you say nurses even pay, you say a developing country trying to compare our wages to a first world country. Chai, I don't think you're following the conversation. I'm not going to read anything else from you. Caleb says, nurses even pay hospital bills when they are sick. Ibn Siraj says, the financial clearance delay is on the back of incompetence, and I agree with Dr. Arthur. My first day at work in the UK, I filled my forms for salary, and I was paid at the end of the first month. There are so many other messages. I'm sorry, I can't read all of them. By the way, the messages about not being paid for 12 months, national service personnel, and then the benevolence of others, that was sent through by Engineer Mahama. We've hosted him many times on our flooding situation in this country. Gentlemen, final thoughts. Dr. Arthur Kennedy, I'll start with you, and then I'll go to Umar. Doc.
Okay, thank you. First, let's pay people better. Abuja Declaration said we'll spend 15% of our budget on health. We are now at 4%. Let's be more competent. It is unacceptable that people will graduate and sit at home for sometimes 12, 18 months or 3 years before they can work. These problems are above the heads of Ghana Health Service and regional directories. The presidency and parliament must engage the problems so that they can be solved, and bosses must be more nurturing and more to the point. We should exploit the skills of those abroad and get them to contribute, and we should make it easier for them to return when they want to. When you need nurses and doctors, it is not wise to put obstacles in the way of their retirement.
Thank you so much, Dr. Arthur Kennedy. You always make it so simple. Thank you, sir. Umar, from where you sit, what do you think can be done about the situation? I've heard something about, there may be a policy where for every nurse that is taken, some token is given to our government. Is that a solution?
So, Ben, I mean, coming in, I wanted us to provide solution to this. I mean, right on this show, but I don't think it is really possible as it stands. But then, in my opinion, they're suggesting that some token should be paid for every individual that is taken out of the country. Is only going to breed more corruption, and also, as said by Dr. Arthur Kennedy, at the back of the Abuja Declaration, if the cake is small, then government should think about baking another cake, a bigger cake, and also, let me use this opportunity to clear this. There is this issue of a red listed countries, which Ghana is part. The red list doesn't prevent, employers in the UK from employing in Ghana. No, what it does is that it prevents agencies from holding job fairs in Ghana, just like it happens in Dubai and then in Philippines, etc. But it means, as a Ghanaian nurse, if you want to practice in Ghana, if you feel you'll be appreciated more in the UK, you can apply to any employer in the UK. If they find you fit for the job role, they will employ you, and then they can start doing your paperwork, and then you can come to the UK. Nothing stops you from coming to the UK as a nurse. Anyway, to wrap up, let me say a big shout out to my friend Pius Lugudo Brian, who first interviewed me on this same topic. He's an aspiring SRC president in US, where I graduated. Pius Brian, good morning. And then, well, to your viewers, I'll say thank you very much. And I think the solution is that our politicians need to be truthful to the people. We need to tell the people what it is. We need to be open up to the people, and it shouldn't be politics as usual.
All right.
On the issue of
Umar, we have to go. So very briefly on that point.
Yeah, on the issue of nurses allowance, I wanted to touch on that. It is it is outmoded. It has outlived its purpose. As a substitute to that, I have a brilliant idea I could give out anytime. It is working somewhere else, and I think it will work in Ghana, where student nurses, student medical doctors pay for the allowance they are going to earn every month. And I tell you, it is more efficient. You get people to work for whatever they are going to earn. It's not what is happening now, where people are paid to sit at home.
All right. So maybe that's a proposal you should run by the Ghana Health Service. And do we still have Dr. Chum? Dr. Chum, are you still with us?
Yes, please. I'm still here.
Okay, so you have the final bite.
All right. Thank you for the opportunity.
Very briefly, please. I'm sorry. Very briefly.
Yeah, that's okay. Thank you for the opportunity. And I think that, as I recounted earlier on, we need to prioritize the competencies, the skills of nurses and midwives, and pay them commensurate salaries and allowances. Immediately, what we can do, as I suggested earlier on, is to raise the market premium. That will give us the ample opportunity to look out for other medium to long-term solutions. But the immediate-term solution is to tackle the economic situation in which nurses and midwives find themselves in Ghana. Thank you for having me.
Thank you so much, gentlemen. Now, Amenla Chia Akbole says, my sister completed national service last month and ... We nurses suffer here in Ghana, especially those in primary healthcare. That is Burma Yabua. My final one, Imoro Abdul Jalil Bakrakoji says, Ben, even common apparatus such as BP machines and basic equipment are not there to work with. So when we highlight these issues and the likes of, sometimes I get so passionate about these things. When you see Kwame Sapon coming in, throwing dust in our gari, so to speak, you can share your thoughts, all right, but be patriotic about it. Don't just sound a certain way because you want to sound a certain way. How do we solve the problem? That's why we're here, Mr. Sapon. Anyway, this has been our conversation on health and the flight en masse of our nurses. If we don't talk about it and tomorrow you go to hospital and you don't get a nurse, you will come back and say the media is not doing its work. Now, before I tell you what we're going to do next on the show, water is life, and I'm going to be taking a sip of Awake Purified Drinking Water when I go on that break. It's premium purified water treated through a strict purification process to ensure that every bottle on the market refreshes you better. And guess what? They have perfect sizes for everyone. You're thinking of the kids, 330 ml backpack, they're good to go. If you're thinking you want more water, 500 milliliters, 750 milliliters, or 1.5 liters for those who always want to drink more. But if you're thinking of something for your office or home, how about their 19-liter jar bottles, which are ideal for the situation? All you must do now is drink Awake Purified Drinking Water wherever you go, and you will get quality hydration. It's another product from Casapreco Company Limited. Now, the heartwarming part. For every bottle you buy, a donation is made to the National Cardiothoracic Center, especially as treating heart disease is so expensive. Each time you buy Awake Drinking Water, you put a coin in there for such people. If you'd like to purchase in bulk, the number to call 0262 351 251. 0262 351 251. This advert, of course, is FDA approved. When we return, Bernice Abubedu Lanza will be taking you to the Volta region, Ho to be specific. What has been happening there? The flooding and the destruction it left in its wake. How do we tackle flooding in Ghana? What is the way forward? That conversation after the break.